Gonorrheal endocarditis. Systemic gonorrhea produces heart lesions in from 10% to 20% of cases. Thus, Nolan recognized heart lesions of probable gonorrheal origin in 16 out of 115 cases of gonorrheal arthritis, and Sears in 25 out of 167. Sears has analyzed 68 cases of gonorrheal endocarditis, of which 61 were in men, 7 in women. The heart lesion was associated with arthritis in 56 cases, in 48 of which the lesions involved 3 or more joints, while in 10 there were no joint lesions. The heart was involved during the first gonorrhea, certainly in 31 cases, probably in 9 more. In one instance, the heart is alleged to have been involved during the second day of a gonorrhea. As a rule, the lesion was first noted during the 5th or 6th week. Pathology. The lesions are usually confined to the heart valves. Exceptionally, there is pericarditis or myocarditis. In 38 cases, the mitral valve alone was involved. In 12, the aortic, and in 2, the pulmonic. The mitral and aortic were both involved in 8, the mitral and tricuspid in 1, the aortic and pulmonic in 1, Sears. The pathologic changes in the valves usually consist in small, friable vegetations made up of plasma cells, leukocytes, and red blood corpuscles in a loose framework. Sometimes the valve is exulcerated, even perforated. Gonococci may usually be cultivated post-mortem from the lesions and sometimes antemortem from the blood. Clinical types. 2 clinical types are recognized, viz. Simple gonorrheal endocarditis and malignant gonorrheal endocarditis. Neither type shows any clinical peculiarity to stamp it as gonorrheal. The former is mild and insidious in onset, perhaps entirely latent, so that the resultant murmur, perhaps recognized years after, may be the only symptom. The malignant type, on the other hand, usually begins abruptly with chill and progresses with intense septic fever. Yet the types are neither fixed nor exclusive. A case may begin mildly and become malignant later, or, beginning in the most acute fashion, it may rapidly subside. Diagnosis. A patient who develops a heart murmur or malignant endocarditis while suffering from gonorrheal rheumatism may be put down as a case of gonorrheal endocarditis. This diagnosis is confirmed by the complement fixation test or the cultivation of gonococci from the blood. Prognosis. Sears believes that a mitral lesion offers a better prognosis than any other, since of the 43 cases in his series that recovered, 33 gave signs of lesions in that valve. Cardiac symptoms, if present, usually persist a month to 6 weeks. Septic symptoms 2 to 4 weeks. The damage to the valve is usually permanent and the murmur persists. Fatal cases usually terminate in 2 or 3 weeks, but the patient may survive several months. Treatment. The treatment is that of endocarditis plus the anti-gonococcus vaccine or serum.